median and ulnar were positive, and then when I did radial, scoot this way a little bit more, yeah. When I did radial nerve, that was the most positive. Right there? Yep. Okay. So all three are positive. So what does that mean? That probably means, with very high probability, he's got thoracic outlet. Which means that in the outlet of the arm, the shoulder, neck and shoulder, you have 4 entrapment sites. Your scalenes, the space between your first rib and clavicle, which is called your costoclavicular space, behind the pec minor, and then the anterior shoulder. None of these positions are really stressing the anterior shoulder. So I'm thinking if it's TOS, it's probably scalenes or pec minor. I did attest the pec minor, stretched it, palpated, it was negative. I just palpated scalenes and I could tell it was guarding, okay? So what I'm gonna do is, how do we treat muscle guarding? Anywhere in the body, guys. Soft tissue, joint oscillation. So I'm gonna do a little soft tissue to him, okay? And this will be a good little soft tissue review. Scoot towards me, because we're doing soft tissue next, okay? Remember, you're being tested on the nomenclature, so you need to learn the words, okay? So I'm gonna start with the scalenes run like this, yes? So I'm gonna go across their fiber. So this is called cross fiber, okay? And I have to do a little bit of motion right off the bat with this to fit my hand. So this is cross fiber with motion, okay? If I was doing parallel with the muscle right now, it would be muscle pump. You doing okay? Yep. Okay. I didn't check his joint mobility earlier, so. Okay. So now I'm gonna do a little traction. Just to inhibit. So I'm just doing oscillations. You can see I'm just doing graded oscillations here. Okay. And I can add a little side bending rotation to get a little creative, because scalenes are rotations too, but they all do same sides. They all do same side bending. So I'm just mixing it up. Okay. Now I'm going to get to my hold, relax, contract, relax. So go ahead, push to the left here, lightly. That was too much. Half of that. Good, perfect. Again. Good, a little bit forward. Good, a little bit to the right. A little bit left. A little bit forward. A little bit right. Good, relax. Back into, I can already feel it's loosening up. So you're going to do this exactly the way I'm doing it with your patients, like the order. You do a little cross fiber with motion. Add a little joint mobility, add some hold. If you're not adding submax isometrics to your soft tissue, you're going to be really, really happy when you do, because it's going to cut your soft tissue time in half. Okay? Just a little up glide here of the neck. Okay? A little bit more soft tissue. Okay, I'm going to do one more. Just push here, okay, push forward, push here, push opposite. Good. Okay. Okay, now let's just recheck. Okay. Now that was like what? 90 seconds, maybe a minute and a half, maybe 2 minutes, okay? Now come over here. Now it may need more work, okay, and I have no idea, right? He's not a paid part of the show, so I don't know how this is gonna work, but just after 2 minutes, let's see if he's got more. That's already 20 degrees more. You feel anything yet?
Yeah,
Right there? So that, I let go of the depression so you can see it, but he went from about 60 to about 80. And that was with a minute and a half. How did that work? Just neuro stuff, guys. Soft tissue is a neuro technique. Yes, you have a little increased blood flow. It's primarily a neuro technique. How? Mechanoreceptor input to the dorsal horn. Okay? Targeted tissue, fascia, a little bit of the muscle tendon, because I was stretching it a little bit, putting a little tension on it. Submax isometrics, hold, relax, contract, relax. It's just tricks activating the GTOs and the tendon of the muscle, and also the muscle spindle, getting that muscle to relax more. Once the scalene relaxes more, it's not putting pressure on the brachial plexus. Now he's going to get more motion. Okay? Average therapists are going to take this patient and they're going to floss them. Okay, that's a mistake. The nervous tissue is going to get irritated. And I'll tell you why. Nerves act like a garden hose. Okay? You turn on the hose, right? And the water comes out the end. So all this water or nerve energy, electricity, is going down into the hand, right? Your 3 terminal branches are median, ulnar, and radial. So right now the water hose is getting crimped. So you know when you get a water hose and you hold it and you crimp it and less water comes out? That's what's happening here. So does it make sense to pull the water hose, or does it make sense to undo the crimp? It makes sense to undo the crimp. All I did, and I proved that to you right now, all I did was did a little soft tissue here for 90 seconds and some other neurogenic techniques like joint mobilization and hold, relax, contract, relax, which is part of your soft tissue, and got this muscle to relax more, and then he had more range of motion and less nerve type of pain. Now, if I had a full 45 minutes with him, I could probably eliminate that altogether, all right? Because I would add an exercise. We'd get up and he'd be doing things like vascular things like the arm bike. He'd be doing active range of motion because of the scalenes. So your scalene anticus does opposite rotation. Your scalene medius and posterior do same side rotation, and it's his left side, so I'd be doing both rotations. And by the time I can be doing shoulder depression to help just if there's any costoclavicular issue, I didn't check that. Okay, so that's the whole thing. And that will help a lot. And I did that because he had scalene tension. What would happen if he had pec minor? Well, I'd be doing all scapular stuff and protraction. That would change my treatment. That's why it's important. That's why when you talk to therapists, they're like, man, thoracic outlet, like sometimes the stuff I do, it works so good and sometimes it doesn't work. It's because you don't know how to evaluate it. It's 4 treatment areas. And if he had anterior shoulder instability, I'd be doing all rotator cuff stuff with him. And if he has 2 out of those 4, which sometimes happen, you have to address both of those things. So I love cases like this because it just shows you the possibility of when your evaluation gets that nuance and that affects your treatment, how quickly you can get changed like that. Okay? So he's going to go home later tonight. He's going to feel a lot better, have more motion. And if he does the home exercise program I give him, he's going to feel a lot better by the time we get to Monday. Like, let's pretend this is Friday. All right, so your treatment's over. I'll see you on Monday. Make sure you're doing these exercises. So he's got muscle guarding. So what does he have to do at home? He has to do things that bring blood flow to that muscle. So I already kind of talked about it. I'm going to have him sit up straight. Every hour, every 2 hours, he's going to do a set of 10 to the left and a set of 10 to the right. And he's going to do that 4 or 5 sets each way. Because our circulatory vascularity is 30 reps. But in the neck, it gets an exception because if I have to do this 30 times, he's going to get dizzy. So instead of doing 3 sets of 30, you have him do 5 or 6 sets of 10 to 15, and it comes out to the same number of 90. Okay, and that's going to bring blood flow. He's going to do that every hour. Okay, and then this will calm down. And then what I haven't figured out is why the scalenes are guarded to begin with. So I'd have to really do a deeper dive into the neck, which we're not going to do right now. Okay, but there's a reason why those scalenes are acting that way. He's probably got a little bit of, based on what I just felt in his neck with the joint mobility, he's probably got a little hypermobility in his neck, and he needs to start to do some coordination training once we get the scalenes better. Okay. So remember, with the exercise part, you start at 50%, that's all circulatory exercise and tissue healing. And then the next step up is 60%, so I would give him light resistive exercise. Once he can do that, then I'll do 75 and 80. All right? The mistake other therapists typically make is they'll go from cardio 50% and they'll jump to 80% at 3 sets of 10. And that middle ground is very important to make sure you step up. Okay. 424. Okay.